Now, using our 3 steps, let's break this down. Now, this question's asking, what should the nurse implement for the key problem, a patient who's receiving mechanical ventilation after falling from a tree? So the biggest thing we're thinking here is assessment. So the solution we're looking for is, what do you do with this new patient? Now, all the options are correct. So option number 1, assessing for implanted devices. Guys, the patient will likely need imaging. So always assess for what's underneath the skin here. Now, option number 2, continuing on in the assessment here, we always complete head-to-toe assessment when needed. And option 3, medical alert to obtain medication or medical history. And option 4, secure belongings to prevent loss or stolen items. So it's correct. And lastly, option number 5, also correct, remove contacts, guys, to prevent eye injury or even infection. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for needing correction. For the key problem, the nurse tells the PCT, or the patient care tech, that a patient with altered level of consciousness is getting out of bed. So immediately we're thinking safety and fall risk. So the solution we're looking for are actions that are incorrect by the tech here. So option 1, we have to skip because frequent checks are good to prevent the fall. Remember, we're looking for incorrect options here. And option 2 and 3, we have to skip, since bed alarms are good to alert when the patient's getting out of bed. And option 3, fall risk sign on door helps alert the staff and visitors to the risk. So option number 4 is correct. Guys, wrist restraints require an order here. So that was the incorrect thing, so we have to choose it. Okay, that wraps. Now, using our 3 steps, let's break this down. This question's asking for the highest priority for the key problem, which patient needs an indwelling urinary catheter. So guys, the biggest thing I'm thinking before the options here, someone with a renal issue, someone who needs strict INOs, maybe even someone with mobility issues. So the solution we're looking for is the patient who requires the urinary catheter the most here. So option number 1 is incorrect. Guys, the patient's incontinent and they don't require an indwelling catheter. Remember, least invasive to most invasive here. They can pretty much use diapers. Now, option 2 is correct. The patient who is retaining urine needs that relief. Guys, if they can't void independently, then they require a catheter. Now, option 3 and 4 are also incorrect here. Altered level of consciousness doesn't require an indwelling catheter. Remember, that patient can actually hurt themselves more if they're pulling at that catheter. And they can always use a bedpan too. And option 4 is incorrect. A patient using furosemide, which is that diuretic, remember furosemide makes the body dried, they don't require a catheter. Now, sure, it would be a lot easier for the nurse, but technically it's not the most urgent out of all the options. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the most critical finding in the key problem, patient going to MRI. So the big memory trick, guys, think of the M in MRI as M for magnet. So anything metal, we have to report. So solution that we're looking for is metal, guys. So no pacemakers, no metal piercings. So option 1 is incorrect. An allergy to shellfish. Guys, this does not include iodine. So MRIs, the question didn't even say anything about iodine. We're looking for metal here. So option number 2, it's okay to eat before admission. So guys, option 2 is incorrect. Now, using our 3 steps, let's break this down. Now, this question is asking for correct statements by a parent for the key problem, child being treated for multiple bed bugs, guys. So, biggest thing we're thinking here is itchy, contagious, and cleaning the bed. So, solutions we're looking for are statements that reflect parent understanding of the proper treatment. So, option number 1 is correct. Everyone should be protected because bed bugs are quickly and easily spread. Now, option number 2 is incorrect. You should use anti-itch at night to prevent waking up and scratching, which interrupts sleep. And option 3 is correct. Over-the-counter antihistamines prevent scratching and itching, which decreases the risk for infection with that broken skin. And option number 4 is incorrect. Guys, bed bugs live in bed sheets and mattresses and can be found in cracks and crevices inside the home. And lastly, option number 5 is correct here. So signs and symptoms of infection should be closely monitored and reported to prevent complications here. Okay, that wraps it up. Now, using our 3 steps, let's break this down. Now, this question's asking for statements that alerts the nurse to the key problem of a true allergy. So before looking at the options, guys, you should write this down and put this to memory. True allergies are considered anaphylactic reactions, usually involving the airway as well as hives all over the body. So the solution we're looking for are something the patient says that regards to swelling of the airways or something with hives. So option number 1 is incorrect. Restrictions on salts for furosemide, guys, that's just not even related to any type of allergy. Option 2, a migraine with birth control. Technically, that's a normal side effect, not an allergy. So there's no airway or hives here. So option 3, also incorrect. Puffy ankles with prednisone. Guys, remember, prednisone puffs the body. That's a normal side effect. No indication of hives or airway. Now, option 4 and 5 are correct here. So option 4, tongue swelling with peanut butter. Think airway. If the tongue swells too much, it obstructs the airway. And option 5 is the hives with penicillin. Huge allergic reaction. Guys, think hives and airway. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question's asking you to place and order the problem of removing PPE to avoid contamination. So the solution here is, first we do option 5. It's always gloves, guys. Then the goggles or face mask. Then the gown. And then actual mask like N95 or surgical mask. And the very last thing we do, technically before and after, we always do hand hygiene. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the priority action of what do you do right now. So, the key problem here is assessing the confused nonverbal patient who has a FLAC pain score of 9 out of 10. And they just had fentanyl 30 minutes ago. So guys, before we look at the options, I'm thinking assessment, guys. Assessment comes before paperwork. So, the consent can wait, but guys, the patient's pain comes first. So the biggest solution we're looking for is addressing the patient's pain problem, not really addressing the paperwork. So option number 1 is incorrect. Waiting for family consent doesn't resolve the pain problem right now. So option 2 is correct. Assessing the patient's pain determines the cause of the pain. And option 3 and 4 are incorrect. So option 3, over-medicating with fentanyl can cause an adverse reaction. And option 4 is incorrect. Confusion assessment doesn't really help associate with the pain right now. So just remember, assessment comes before an intervention here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking what to report to the primary provider or the healthcare provider. For the key problem, patient that's scheduled for an MRI, and it doesn't really matter what's going on with the patient. The biggest thing we're thinking about is memory trick. M for MRI is M for magnet. So the biggest solution, guys, we're thinking here, removing all metal, pacemakers and piercings, the double P's. So option number 1, breast implants are okay with MRIs. But option number 2, that's our correct option here, implanted defibrillator, guys, not okay. Remember, magnets with MRIs can cause definite malfunction here. And option 3 and 4 are incorrect here. Guys, a fentanyl patch is okay to use with an MRI, and an ileostomy is okay with an MRI. Now, using our 3 steps, let's break this down. This question's asking to choose a patient for the key problem, the patient who needs a private room. So immediately I'm thinking a transmittable or transmissible infection or a risk for infecting other clients. So solution we're looking for are the patients who can easily spread infection and at risk for being infected here. So option 1 is incorrect. Technically speaking, AIDS are standard precautions, and HHNS, guys, that's a diabetes condition, so it's not contagious. Option 2 and 3 are incorrect. CHF standard, guys, and latent TB is not contagious. And option 3, hepatitis virus is a standard precaution, so it's not contagious. Which leaves us with option number 4, which is correct. MRSA, guys, we're thinking contact precautions, and it's easily transmittable. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for the correct statement by the patient for the key problem, fall prevention measures. So guys, write this down if you didn't know. The biggest safety items that I'm thinking here are no rugs and well-lit halls, as well as handrails. Big fall risk prevention. So guys, the solutions we're looking for are statements that are accurate with safety and fall prevention. So option number 1 is incorrect, guys. No hall lighting at night is not good. Definitely going to have a fall because patient can't see. And option number 2 is correct. Securing the bath mat, guys, we won't have a risk for slippage and fall. Now, option 3 and 4 are incorrect. No skid slippers should be worn at all times, even inside the house here. And option 4, a fall alert device should also be worn always. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the correct order for the key problem. You're taking off or removing that PPE for the contact and airborne precautions here. So the biggest thing I'm thinking before looking at the options are preventing contamination and exposure. So solution we're looking for are the correct steps to take off PPE to minimize that contamination. So first we do option 2, place the bed in the lowest lock position. Guys, that's safety, prevents any type of falls. Then our second step is to ensure the patient can reach out to the call button so they can alert if they need for help. Then third, we remove all PPE except, key term here, except the 95 mask. So N95, guys, masks are always removed last. And we wash hands before leaving. And our last 2 things here, we always exit the room and make sure the door is closed as we follow precautions. And very last, we take off that N95 mask and then wash your hands again. Okay, that wraps it up. For more details, Now, using our 3 steps, let's break this down. So this question is asking for the correct order of the key problem, removing PPE after dressing change. So guys, the memory trick we use for contact precautions are GG, G, and M. So triple G's and the M. So gloves, goggles, or that face shield, then the gown, and then guys, your mask. So the solution we're looking for are the order that decreases the risk of contamination for these contact precautions. So option 3 we should do first, guys. Gloves are always first. Then it's the face shield or the goggles. Then third, we remove the gown. Now, using our 3 steps, let's break this down. This question's asking what to do for the key problem. A patient keeps trying to take out their IV despite being told not to. So the biggest thing I'm thinking before looking at the options is how do you secure the IV so the patient can't remove it? So the solution we're looking for is the next option to prevent the patient from taking out that IV. So option number 1 is incorrect. Guys, we never restrain patients just to restrain them. Usually needs an order and it's very invasive. So option number 2 is the best option here, covering the site to prevent that patient from tearing that IV out. And option 3 and 4 are incorrect. Restraint is invasive and needs an order. And option number 4, using an arm board is used to maintain the IV site, but it's usually used for patency and not usually used to prevent someone from taking out their IV. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question's asking for the appropriate prescriptions here, or the appropriate orders. For the key problem here, a patient with triple lumen CVC, or central venous catheter. So the biggest thing I'm thinking is giving meds, fluids, drawing labs, and measuring that CVP, central venous pressure. So solutions we're looking for are the correct ways to use this line. So option number 1 is incorrect. Unused ports should be HEP locked. Now option 2 is correct. TPN is okay to give through a central line. And option 3, CVP can be monitored in a central venous line. So option 4 is incorrect. Occlusive dressings are changed every 7 days. And option 5 is correct here. Proximal and closest port is used for blood. Okay, that wraps it up. For more details and test tips, now using our 3 steps, let's break this down. This question's asking for nursing interventions to prevent aspiration, or basically breathing in secretions or breathing in food. Guys, for the key problem, patient on a ventilator who's getting an NG tube feeding or nasogastric tube feeding. So the biggest thing I'm thinking before looking at the options, guys, we need that head of the bed up, we need to protect the airway, and check tube placement for that feeding. So solutions we're looking for are actions that reduce the likelihood of aspiration here. So option 1 is correct. Assessing or checking for abdominal extension reveals if the patient is tolerating the feedings. Option 2 is incorrect. Guys, GI residuals should be checked at least every 4 hours. And option 3 is correct. Semi-Fowler's, remember, the head of the bed is up, decreases that risk for aspiration. And option 4 is incorrect. Sedation vacations are good, but it's not related to aspiration risk here. And option 5 is correct. Any medication, including lorazepam, should only be given as ordered. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for which action needs correcting for the key problem, the student nurse caring for a patient with vertigo and tinnitus, basically that ringing in the ear. So guys, the first thing I'm thinking about before we look at the options Is vertigo, is dizziness, so big risk for falling. So the solution we're looking for are inappropriate actions for this patient. So guys, we're basically looking for the wrong actions here. So option number 1, we have to skip because it's correct. Patient needs help with positioning. Guys, they'll be dizzy with poor balance and coordination. Option number 2, we have to choose because we're looking for the incorrect options, guys. Guys, we always make sure to lower the bed to prevent that fall risk. And all 4 side rails are up. Guys, that's a restraint. We cannot do that without the right paperwork. And option 3 and 4, we have to skip because they're correct. So dimming lights help with resting, as well as turning off the radio helps to decrease stimulation when resting. So option number 2 is our correct option here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question's asking for measures to implement for the key problem, C. diff infection. So the first thing we're thinking before looking at the options are contact precautions with stool. Remember, C. diff is in the stool. So guys, the solutions we're looking for are ways to prevent the spread of this infection. So option number 1 is correct. We always clean equipment that gets rid of the possible C. diff and making sure it doesn't spread. Option 2 is correct. A patient with C. diff needs to be on contact precautions. Guys, away from the stool. And option 3 is also correct. Soap and water is the best form of hand hygiene. And lastly, option 4 and 5 are incorrect. Guys, there's no mask that is needed since C. diff is a contact precaution with that stool. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. Now, this question's asking for priority action, or basically, what do you do right now? For the key problem, nurse making bed assignments for a new admission. And the patient has low WBCs, or white blood cells, low neutrophils, low hemoglobin, and low platelets. So guys, the biggest thing we're thinking about is immunocompromise and risk for bleeding. So a solution we need to choose is room to limit an infection for this neutropenic patient here. So option number 1 is correct here. A private room and reverse isolation to protect this patient from infection. Remember, this patient has low white blood cells, so has to be on neutropenic precautions. So option 2, 3, and 4 are incorrect. Erythropoietin for RBCs. Guys, no RBC data here, so it really doesn't help. And option 3, injections increase the risk for bleeding, but doesn't nothing to help the patient right now for a room assignment. And option 4, physical therapy doesn't address the patient's problem. There's no indication that physical therapy is even needed here. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for the nurse's response to the key problem, patient admitted with dehydration at risk for syncope, or basically passing out, who looks weak while walking. So guys, the biggest thing we're thinking here before looking at the options is I'm thinking safety and fall risk. So a solution we're looking for are the correct actions to do with this patient. So option number 1 is correct here. Safely assist the patient to a seated position to avoid that fall risk. Guys, anyone who's dizzy while they're ambulating or thinking they're going to pass out, always put them on their butt in a seat first. Now, option 2 is not safe since the patient can fall on the nurse. So that's incorrect. Option 3, there's no indication of a gait belt, so that's incorrect. And option 4 is also incorrect. You cannot help the patient to the floor with a straight back here. Okay, that wraps it up. For more details and test tips, please see the... Now, using our 3 steps, let's break this down. This question is asking for the priority action of what to do right now for the key problem. Parent calls and says the toddler's in the bathroom with an empty cough medicine bottle. So guys, the first thing we're thinking is that baby drank the med and now is poisoned. So the solution we're looking for are actions to do right now to keep that toddler safe. So option number 1 is incorrect. Guys, you can't wait for that pediatrician appointment. Possible poisoning, we need to address it right now. And option 2 is also incorrect. You can't tell the parent to give the kid Gatorade, and there's not enough data if they drank the med. And so poison control would determine that treatment. Now option 3 is also incorrect here. It's good to call the poison control number, but you need info first. So you don't know if that child drank the medication. So option number 4 is the correct option. Describe the kid's behavior, gives an assessment if they drink it or not. So again, guys, assessment before an intervention here. Okay, that wraps it up. For more details and... Now, using our 3 steps, let's break this down. This question is asking for the top priority, basically the top nursing action, for the key problem, a high risk for fall. So before we're looking at the options, we're thinking preventing fall risks. So guys, bed alarm should always be on, fall risk signs, and non-skid socks. So a solution we're looking for are which actions are the most important to prevent this patient from falling. So option number 1 is correct here. Bed alarms alert everyone immediately if that patient's trying to get out of bed, which prevents falling. Option number 2 is incorrect. Guys, wrist restraints are pretty invasive and injury potential if the patient falls out of bed with their hands attached to the bed. Now, option 3 is also incorrect. Being close to the nursing pod is good, but guys, you can't watch that patient every single moment. And option 4 is also incorrect. Checking hourly is not enough. The patient can fall anytime between that hour. Okay, that wraps it up. For more details and test tips, please see the rationale below. Now, using our 3 steps, let's break this down. This question is asking for nursing actions to include, for the key problem, you're caring for a patient with a central line who wants to reduce infection risk for this line. So guys, the biggest thing I'm thinking, central lines, big risk for infection, we need asepsis technique. So the solution we're looking for are the correct things to do to prevent infection in the central line. So option number 1 is correct here. Keeping your nails short and clean prevents germs from hanging out under those nails. And option 2 is also correct. Guys, washing your hands always before and after any patient care is always a huge NCLEX standard. Now option 3, big time incorrect. Chlorhexidine wipes for bathing, guys, we never do that. We only use chlorhexidine to disinfect surfaces as well as equipment here. Now option number 4 is also incorrect. A gown and mask are not needed when you're giving meds because we don't have any isolation precautions here. And option number 5 is correct here. We want to prevent the spread of infection by cleaning the catheter hub for a minimum of 15 seconds for any central line. So guys, 15 seconds, big NCLEX tip. Okay, that wraps it up. Now, using our 3 steps, let's break this down. This question is asking for the appropriate nursing action for the key problem. Patient has a positive Romberg test. Now, if you guys didn't know what a Romberg test was, then use this memory trick here. Rome in Romberg test requires the patient to roam around, or basically walk around. So just think of the solution here. Safety with moving around. We need to keep that patient safe. So looking at our options here. Option number 1 is correct. Guys, the patient needs assistance with walking since they have poor coordination. Remember, Romberg test, they need help roaming around here. Now, option number 2 is incorrect. The patient doesn't have an issue with seeing, and option 3 and 4 are also incorrect. Checking the patient's understanding doesn't help with their fall risk, and option 4, patient doesn't have a problem with drinking liquids. So, now using our 3 steps, let's break this down. Now this question's asking how to advise a patient with the key problem, the patient just doesn't want to wear their SCDs. So guys, the biggest thing we're thinking before we look at the options is how do we educate the patient, reinforce, as well as check their understanding? So the biggest solutions we're looking for are statements to best get that patient to wear the SCDs. So let's look at our options. Option 1 is technically incorrect. Guys, it's our patient's choice to not wear the SCDs. There's no documents that need to be signed. The patient just needs to be encouraged and educated here. So option 2 is also incorrect. Guys, talking to the charge nurse and telling mommy kind of thing doesn't encourage the patient to wear those SCDs. So option 3 is correct here. Educating the patient about the need for the SCDs and the potential complications reinforces the need and also educates the patient. And option 4 is incorrect. Assuming the insurance issue, guys, that's